Hi, it's Carl Lishing, independent insurance agent based out of Lakewood, Ohio. Today we're going to talk a little bit about original Medicare, what it covers, what it doesn't cover, who needs it, who doesn't. There's often questions about if I'm still working, do I need to go on to Medicare or can I go without it? So we'll address that in this segment. In the second segment related to this, we'll do a deeper dive on original Medicare with a supplement versus going with a Medicare Advantage plan and talk through the pros and cons, but I'll have it separated into two different sessions. Now, to start, original Medicare goes back to the 1960s. It has two parts, Part A and Part B. As long as people work in the United States for 10 plus years and pay into Social Security for that period of time, Social Security, Medicare taxes, and they have earned enough credits to pay for Part A, there is no premium. If that is not the case, people have to buy in. It can be a little bit pricey. Medicare Part B, you have to pay a premium for it. And as you can see here on my screen, in the year 2024, the standard premium is $174.40. The Part B deductible this year is $240. That applies to outpatient services like medically necessary doctor's visits, specialists, diagnostic testing, so on and so forth. The Part B immunosuppressive, that's a tough word, drug premium is $103. Most people that doesn't apply for. There's a link there. I can click on it and it'll take us to Medicare's website and show us more who it is for. But this is for people that have like end-stage kidney failure. They're on anti-rejection medications. So it doesn't impact most people, but there are some that it could. Now, over and above that standard premium of $174.40 for Medicare Part B, some people pay more than that. So if they're single and their income is over $103,000, or a couple filing joint over $206,000, or if they file separate, it's that individual number of $103. They pay more, and we're going to go over that here in a second. It's something called IRMA, Income Related Monthly Adjustment Allowance. We'll come back to that. Now, let's say somebody ends up in the hospital and they have original Medicare, and it's a hospital stay less than 60 days for that benefit period. The deductible is $1,632 in the year 2024. Now, if they have a longer term hospital stay, days 61 to 90, if they have just original Medicare, the member would be responsible for paying $408 per day. And then beyond days 90, there's what are called lifetime reserve days. Everybody gets 60 of them. Those go to $816 a day. Beyond that, Medicare doesn't cover anything else. Now, for skilled nursing facility, this is facility-based rehab. There's no copay for the first 20 days. Days 21 to 100, it goes to $204 a day on original Medicare. So that's if somebody just has original Medicare only. Now, if they have just original Medicare, they also need to get a standalone drug plan. If you don't get drug coverage when you're eligible for Medicare, there's a late enrollment penalty in the future in limited periods of time when you can get it. So there's two ways to get standalone drug coverage, drug coverage. You buy a standalone product. I've seen plans as low as $0 a month, as high as $110. It's kind of based on your county and what's available. There's Medicare Advantage with prescription drugs built into it, which are called MAPDs. That would satisfy the Medicare Part D drug coverage requirements. Now, if somebody's still working and they have employer-sponsored coverage, as long as their employer-sponsored plan meets the minimum coverage requirements for Medicare Part D, that would count, and it doesn't avoid, or they wouldn't have a Medicare Part D late enrollment penalty when they go on to Medicare in the future. Now, if they're still working and they decide that their plan through work is better than going on to Medicare and getting a supplement or joining a Medicare Advantage plan, they can stay on their group health plan and go to Medicare at any time they want in the future. There are no late enrollment penalties for Medicare Part B or Medicare Part D, as long as that Part D plan that they have through work meets the minimum coverage requirements. So some people might find it better to stay on their group health plan. Usually that's if, let's say they have a younger spouse. The spouse is under the age of 65. And for them to be covered, the employee needs to be covered on the group plan to cover the spouse. And if they don't get enough government subsidies to buy marketplace coverage or ACA plans for that younger spouse, sometimes those plans can be a little bit expensive. So they might need to stay on their group health plan to cover the younger spouse. The other thing is if the person has high IRMA charges. Remember I said some people pay more for Medicare, and those increased IRMA charges might make original Medicare kind of pricey. So then they might find staying on the group plan is more cost effective. That could be another option. In a lot of other cases, a lot of the time, people are better off going on to Medicare and either getting a supplement or joining a Medicare Advantage plan, but they just don't know. So sometimes they'll stay on their employer group plan because they don't know any better and they're just used to having employer sponsored coverage. But in a lot of cases, it's better to go on Medicare. Now, it is very case by case, so each person's situation should be evaluated, and we should have a conversation about that to see what's most appropriate for you. Now, let's get on these IRMA charges a little bit for original Medicare. Now, with original Medicare, that standard premium is $174.40. But if people have individual income over $103,000, or if they're married filing joint over $206,000, they're going to pay more. And you can see that here. The Part B IRMA, in this bracket, it's $69.60. This bracket here goes to $174.40. The next bracket down takes it to $279.50. Then it goes up to $384.30 and as high as $419.30 for people over $750,000 a year married filing joint, or individuals over $500,000 a year. Now that IRMA charges also go to Medicare Part D for the prescription drugs, and you can see those over here on this side. They start at $12.90, goes to $33.30, $53.80, $74.20, and then $81. So those are income-related surcharges for people with higher earnings, and then that money is used to help fund programs for people that have lower income and are getting extra help. So I can send you any of these documents if you have questions on the IRMA charges and what they are, or the original Medicare cost. And as you can see on original Medicare, going back here, the Part B deductible is not bad at $240, but over that, you're not done. The member still pays 20%. Medicare pays 80%. The kicker on that is there's no maximum out of pocket on that 20%. So if somebody has a long hospital stay or expensive outpatient treatments and they just have original Medicare, it can get kind of pricey. So it might behoove them to have a supplement or perhaps join a Medicare Advantage plan that caps the maximum out of pocket. And I said I'll have a separate video recorded that gets into the details of original Medicare with a supplement versus a Medicare Advantage and what the pros and cons are to each. If you'd like me to email you any of these documents, send me an email. It's carl.lishing@gmail.com. That's carl.lishing@gmail.com. Thank you and have a good day.